Not, feel free to grab food as we conduct the meeting. We're going to go ahead and get started because we value your time and your attendance. We are going to go ahead and get started. The time is 11:44. My name is Colleen Rodriguez. I am the chair for the Drug and Alcohol Commission, and I call this meeting to order. Time I'd like to ask Marina to proceed with introducing yourself and stating that your attendance is here.
Marina Moreno, present.
Roma Medina, present.
Freddy Cordova, present. Present.
Stanislav Sega, present.
Eduardo present.
Erica Lopez present. Cadena present.
Present.
Angelica Ramirez present. Lidia Perez Gonzalez present. Glenda Llanos present. Catalina Bueno present. Brenda Cantua present. Ana Guerrero present. Mara Mendez present. Dr. Sylvia Dominguez present.
Thank you, everyone. Moving on to the approval of the minutes of November 19th, we're going to go ahead and table it for the next meeting so that we could present. Mr. Walls, I'm sorry, you're in the middle of it.
In the middle of a docket.
Let me give Diego some time. Colleen, I have a question. Did we meet for our last meeting?
Yes, we did.
We did, okay. I thought we didn't. Okay.
Yeah,
I don't know whether I started it.
I have to go back to.
If not, we don't have minutes, right? for the
Yeah, if
meeting?
not, we'll go ahead and revise that and say, but I don't know. We still have minutes
No,
to,
I think
for the
we did.
record?
Okay, great.
Not sure, no. But with that said, we are still looking and we're probably gonna bring it up in a little bit, but if you haven't considered it. The Drug and Alcohol Commission. As a matter of fact, also, I do want to make mention, your attendance is appreciated, but we also do have some people that will either be stepping down or have stepped down. For example, Brianna Science has stepped down from the last meeting. Commission members, and so therefore we were able to meet quorum today. Some of you all have not attended and we need you all to attend. Otherwise, we are going to speak to council if we haven't already done so to let them know to appoint somebody new. We do have a couple of new commission members, and for those of you all that are new and have been attending, we appreciate you all having to come in, as it is important to conduct these meetings. Mr. Walls?
My administrative report will be provided with the detox facility. The county that the construction of the detox, the renovation is on schedule, and we anticipate them handing keys over to the city of Laredo to begin set up and hopefully eventually operation in the first week of May 2023.
That's awesome news. Any? Thank you very much. We're going to go ahead and move on to a couple of things that this agenda looks a little bit like the same or is the same as the last one. The agenda that I have submitted have not been submitted on time. So therefore, some of the stuff has already been discussed. I'm going to move on to the nomination of election of secretary, because that is very imperative that we need to discuss it. As it's also important due to work. Ms. Nancy had to step down. She will still be active and involved. However, because of work, she's not able to proceed with the secretary role. Is anybody interested in wanting to take on that role? So we will continue to hopefully seek somebody that might be interested in joining the secretarial role. And is saying nominate Earl? You can nominate him, but if he accepts, I was just going to mention that having to write the minutes isn't as serious, but serious as it sounds. You do get the support from Mr. Walsh, myself, and staff to be able to do the minutes. As it is, I'm kind of doing like the whole, like what time we started, just to kind of summarize it. Whenever we have discussions like this, it just says Colleen talked a lot. I'm kidding. Colleen mentioned and said this. So if that's something that you are wanting to consider, Earl, then you're more than welcome to. A nomination has been placed on the table. Earl has accepted. All in favor of Earl assuming role as secretary, please say aye. Any opposed? Of course, nobody's escaping. Motion passes. Earl is our secretary. So thank you so much for the committee and the nomination.
I didn't put him on the spot. We were like,
I know I saw it and I was like, I'm not gonna let that be yet. All righty, thank you so much for that. We're gonna move on to the detox facility update, and we've seen and we've heard Mara for a long time, but she's here today. Do you have any updates on the detox facility for us?
just echoing exactly what he said.
Okay,
Pretty much we're on board.
all right, awesome.
Of the building and they're handing it over to the city. It's not something as quick as what you guys would think, you know, oh, we just need to move a wall here. So walking through the facility, it's a detention center. So, you know, this wall is solid concrete, cinder block. And inside the cinder block is cement. So just to drill a hole through there, you need a diamond bit. You know, things are very expensive. So when we walked through with the IT folks a couple of weeks ago, they're like, God, because the walls are all cement, you know, we need one access point for this half of the building. We need one over there. They need an access point almost in every section. I think they counted something like 12 of those little access points, which we have are you need 11 of them over there, and it's not much bigger than somebody's home. So it is a time-consuming process to get that whole facility renovated, but thanks to the county and hats off on the job that they're doing, making sure that those contractors are staying honest.
Definitely, and echoing on that, we appreciate you having to be a representative of the Drug and Alcohol Commission at the courts and having to move it forward, as we are appreciative of Mr. Walsh and everyone here. For us to do like a walkthrough, just to kind of revisit again.
So whenever you want, just let me know and I can go ahead and set it up with building maintenance.
That way, whoever has it, some of the members, some of the commission members are new, some of our stakeholders are new. It might be a great idea to just visit for like 20 minutes. Go out there and kind of get focused on what we're doing and what we're looking for in the future, because these are the things that matter and are important. And sometimes we need to kind of like, hey, like, that's awesome, we're moving forward and it's going to be something great for our community. And it might be something that's good, especially moving into the new year. One of the things I was going to ask everybody to do is to contemplate and think about it for a moment and think what you all want the Drug and Alcohol Commission to look like or be like in the future moving forward. What are some of the goals that you all have as we start looking at resolutions for the new year? I want to make resolutions for the Drug and Alcohol Commission and kind of focus on stakeholders and or getting more involved in the community. I've already said mine. So that's something that I would like for you all to kind of consider and see. And I feel like having to visit the detox facility would kind of make us a little bit more motivated to attend these meetings and to be more involved and be more active in here and outside of our work. So again, thank you both, Mr. Walsh and Mara, for that update. I know for the stakeholder agency updates, we have a couple of stakeholders. We do have a presentation that we had set. Is he going to be in attendance?
No.
That you'd be able to give us?
He was going to send an email that we could forward to everybody here.
Okay, so there was a gentleman who was going to be in attendance who was going to discuss a possibility of a grant.
Right.
And the grant obviously would have to go through the Drug and Alcohol Commission for a vote and for consideration, and see if perhaps an agency would be able to manage it, as record keeping is very important. Monies or that grant would benefit the Drug and Alcohol Commission and or another agency stakeholder here. And so once we get that information, we'll forward it via email and then maybe perhaps bring it up at the next meeting. But I did see the deadlines, and the deadlines are close
Yeah.
to like the next meeting.
Right, and so it's basically Methodist Healthcare. They have something called a Prosperamos Juntos. It's a grant where one organization takes the lead with a bunch of other organizations, and they're looking for an outside the box idea. Wanted, I guess, the DAC could propose some sort of idea, something that's never been done. $5,000 for the first 6 months to foster and nurture the grant. After that, you apply for the actual real grant, which is 3 years, $1 million total. So there's very little concrete guidelines. They want something grassroots, something that's never been done before, but they do, I guess, have their own general guideline requirements that they do want us to follow. I will make sure that the Prosperemos Juntos grant is shared with everybody today, just so you guys can at least look at the website. And I'm so sorry that he wasn't able to present today, because he would have done a much better job than I did. But it is something for everybody to consider, and it doesn't have to be the DAC if you guys want to do it in your own organizations. They did present a couple of weeks ago at the Laredo Health Coalition, and he has been visiting, so I'm sure some of y'all may have heard of it.
Yeah, so the application closes January 13th and it opened December 1st. And I'm looking at the website, and so that's something that Mr. Walls will be able to share with us, an overview of the grant and where it's coming from and how the phases and the funding and whatnot. So that's something for us to consider. Thank you so much, Mr. Walls, for that and making that connection for us. Right now, I'm going to go ahead and updates. You're more than welcome to do so at this time. Anything happening in your agency? Anything going on?
Not from the last session.
Okay. Ms. Linda? Okay.
I'm gonna provide just some information. I'm sorry, I might not have made enough copies, but it's just, I have enough. Okay. But just some information that we wanted to just kind of highlight. First of all, the National Impaired Driving Prevention Month is December. And so alcohol impaired driving crashes, which range from being under the influence of substances to distracted driving to speeding, increase throughout December as most people travel. So we just want to kind of, bring awareness to that. And just to remind, that this holiday season, each one of us has the power to prevent a tragedy, right? And to ensure that those that we know and care about get to and from their celebrations, safely. So it just provides, a few tips of what it is that you can do to be able to, to help. And just that if we practice, the prevention ourselves and in our communities, we can just try to keep everybody safe, and the holidays can be full of joy. On there for an event that we're having. It's a winter clothing donation drive for children and youth. We're to see if the community, can participate in donating. So it would be, as some of you might know, SCAN, we have over 40 different programs, and this would be like for our families. So it would be anybody, for any youth up until the age of 18. So we are asking for new winter clothing, such as sweaters, jackets, coats,
Blankets, like I mentioned, we're also doing a toy drive, so that would also, that's also something that we're collecting. You could drop off donations at our main locations, which would be 1605 Saldana Avenue or 1702 Hendricks Avenue. And, or we would also accept any monetary donations, gift cards would also be accepted. So I kind of included a copy of those, flyers there. I didn't include the one for the toy drive. However, that one, like I said, you know, is also going on. And it would be starting Monday, the 19th. Thank you.
Thank you so much. Any comments or any questions? Thank you to Stan for being out here and giving us that update. Thank you. Any updates from you guys? All right. Eli, I know there's an event going on tomorrow. Would you like to share on the event?
Yeah, so we're gonna have an event tomorrow at the Fire Administrative Building. It's the kickoff for our overdose campaign. It'll be a collaboration between us, Laredo Health, Laredo Fire, and Laredo PD. I am asking, I believe the email was sent out last week or so to most of you guys to see if you could share any resources that you may have. So we're putting together a folder, and inside that folder, there's going to be a couple of resources available here in town for people to take. And so if you have those resources, if you have flyers, pamphlets, or anything like that, it'd be great if we could get them. There's some invitations there. I left them in the entrance. Ms. Erica's going to pass them out. Thank you. And so aside from it being an event where, you know, a couple of the stakeholders are going to speak, we also want to mainly invite the community. So if you know folks, and especially your clients, to come out to this event, there's going to be a couple of other stakeholders there. And we also really want to get them into these folders that are going to have a couple of resources around town. I think that covers it about all. We're gonna have a small section towards the end in case anybody would want to share what resources they have available too.
It is at 10 a.m., right?
10 a.m. at the Fire Administrative Building, yes.
The resources, do you need those like printed out? Do we take them to you, email them to you?
If you could print them out, great. If not, then we can print them out.
Yeah, but if you want, call, Eli will give you his phone number. Call us. We can send somebody to pick it up. We definitely want to give out some great folders, you know, packets to people who need with a lot of it.
In folders.
I would say around 50. We're shooting for 50, so.
Actually a great networking opportunity because there may or may not be somebody that you know or that knows of your program. And I love the idea. So I'll be out there representing the Drug and Alcohol Commission, and hopefully we'll have some other representatives and stakeholders out there as well. Erica, do you have any updates?
No, I mean, we're still in the implementation process of AOT. We do have a meeting this coming Monday with Judge Villarreal. Thank you, Freddie, for that. So we're very excited for this meeting. Hopefully he will be the first judge to jump on board. AOT, and we were also able to get an AOT judge from Fort Worth and an AOT judge from Houston to join us as well in the event that Judge Villarreal has any questions, any concerns. There will also be an attorney there present from the AOT support group if they in case they have anything. From attorneys who are volunteering their time in case we have any legal questions, we can go ahead and address it with them because they strongly believe in the program.
That's awesome. That's great to hear. And I love to hear even more so that you've been able to connect with our commission members. So Freddie, thank you for that. And for anybody, that's the whole point of having to meet and talk about the things that you're all doing with your programs and your agencies, because it may be that somebody else might support and or utilize those services. And so again, this is all for the community. And so we appreciate you all having to share. Thank you. Earl, Marina.
I just, we had a meeting for SCAM, last week, and they were saying how there's a new drug out there. I mean, it's already been out there, but now it's being used, readily by, well, the community, and, there's a lot of, been, more overdoses. It's called carfentanil. And, I wanted to invite, Mr. Eric Estrada from the DPS to see if he can come and give that presentation here so we can get a little bit of more information on that.
Isn't that what they give to the elephants?
I don't know.
Yeah.
Yeah.
It's 100 or 1,000 times as strong as
Yeah.
regular fentanyl.
Yeah,
The tip of a needle head
yeah.
can overdose.
Yeah, they showed a penny and they had like a little drop of it. And they also had like 3 vials and they had like the deadly dose of fentanyl and the deadly dose for carfentanil, and it was like really, really tiny. So, just so we're aware.
That's terrible. And right now that you're talking about that, there's just so much stuff going on, and I'm pretty sure that it's going to get covered tomorrow with the press conference. But kids, I don't know what they're doing these days. I don't know where, if they just think it's a fad, a trend. And not, and it's unfortunate because why they think it's something that they need or that is cool, I have no idea. Earl, any updates on your end?
No, I don't have any update.
Freddie, Gerardo, do you all have any updates on the judges' court?
No, we just look forward to the meeting on Monday. Hopefully something comes out of it. Pretty optimistic.
Same. Very cool. Awesome. Dr. Dominguez, you haven't been here in a while.
I haven't been. I'm a special ed counselor at Nixon High School, and the drug use is out there. It's daily. I know that another high school had to call the ambulance and they had to do the Narcan on a student. We had a overdose last week too. It's every day, all day, nonstop. It's just, I don't know.
Who applied to Narcan?
The paramedics. I know it happened at another high school. They had to evacuate the students. Like, it was pretty bad. And on our end, the overdose, we were like, the student passed out. We had to call the ambulance too, like immediately. So it's out there and it's very scary. I just think the districts maybe need more awareness on what we can do to prevent, a potential death. Because I hate to say it, but I see it coming sooner than later.
I think that's one of the things on the overdose campaign, that they do want to bring education and even training to the schools, so that they can not necessarily prevent the overdose, but at least be able to administer the Narcan until the paramedics do arrive. The only thing is with the fentanyl, it's something we've been seeing at, I know PD mentioned it as well, and fire. With fentanyl, the Narcan, they need approximately, what was it, like 4 to 6 doses of Narcan, when somebody overdosing with heroin or cocaine is 1. So now I'm assuming with the new one, we don't know.
Also, I feel like with the overdose campaign, we've been trying to drift from, putting regular graphics on avoid using drugs or avoid using fentanyl to maybe putting some really hard to them, but see, okay, look, this guy's, around my age. If it happened to me too, this guy, it happened to him and he was doing something else and it was a spike with fentanyl. And so now I should start worrying about if you guys could share these stories that you're seeing to be able to share them with the community more often. To, really try to get an impact on the folks. And also, at least I don't have to get in touch with what folks are using these days as far as subliminal messaging, right? So a lot of the times, kids will message each other with like an emoji, and that emoji means a certain type of drug. And so, it'd be interesting to find out all these codes, put it out there too, so parents could know, you see any messaging between your kids and you're using these emojis, it might not mean that, it might mean instead.
I have right now that you're saying that, I have a mother that I talked to and she was saying me how, they're using a little cake for that.
Yeah.
Like, they would, let's go have some cake and they're making this.
They don't call it cake.
Yeah,
Yeah, well, the cake they usually use it for the baking,
yeah, the baby
because there's a big pen that is called cake.
cake, yeah.
But majority of the cases is that when they buy these pens, some of them here for like 40 people, about $50. Because we've had cases with Orgullo Laredo, with young middle school teenagers that are part of the LGBT that are using it. But we don't know what people are studying it, whether it's originally packed or open, and adding more solution to the vape machine. So that's one thing that we just need to keep an eye, like how they're using the emojis and everything. Each emoji means something different. For us, it might be something, a thumbs up means something to us, but it could be something else. And that's one thing that we need to pay close attention, especially to the high school students and middle school students, because we don't know how they're getting it. Like some of these people are buying these cartridges online.
And you're right, because I went to a conference not too long ago and they said that you can buy all the stuff to make the pens individually. And there have been rare occasions where they have found traces of fentanyl in the vape pens, the THC vape pens.
I'm assuming maybe they'll have more insight on what the emojis are representing or on trends or on rates for each of the schools.
No, but we could make that invitation, for the next, meeting. I think that would be a great idea. As a matter of this,
Like the coalition or?
yeah, like a youth coalition, right? And so I don't know if the health department also shares something like that, that you all have like a health coalition of some sort, but, getting
There's a
here,
youth council.
a youth council. So getting to, getting to that you might want to tap into and just kind of sit through one of the meetings and just kind of hear them. I'm not young no more. And I sit down with a bunch of kids and what is a popular song, or what are you all talking about? Or they'll tell me, right? And then when I start telling them about the reward and how there's money involved and stuff like that, they start divulging more information. And so with that, like, I think maybe just having to hang out happens.
Yeah.
To bring more awareness. And I strongly believe in a campaign that is not more of don't smoke because of this or don't do this because of this, but the more you know, the better type campaign is the perspective, because no kid, no better, the more education that you have, the better. And I think that it's very important that through our agencies that we represent, that we share these stories, because that's how we know what's effective and what isn't. And it's unfortunate. It's like that a couple of weeks ago, it was a Benadryl overdose that